Good afternoon, everyone. My name is Kelly Waters, and I'm a health communication specialist in CDC's Center for Preparedness and Response Division of Emergency Operations. Thank you for joining us for today's EPIC webinar titled Communication Partnerships for Public Health Emergencies. If you do not wish for your participation to be recorded, please exit at this time. You can earn continuing education by completing this webinar. Instructions on how to earn continuing education can be found on our website, emergency.cdc.gov/EPIC. The course access code is EPIC with all capital letters, EPIC0129. To repeat, the course access code to receive continuing education is, in all caps, EPIC0219. Today's webinar is interactive. To make a comment, click the chat button on your screen and then enter your thoughts. To ask us a question, please use the Q&A button. The Q&A session will begin after our presenter has finished. Closed captions are available for this webinar. Today, we will hear from Jonathan Lynch, a senior health communications specialist and core member of the EPIC team. Jonathan is a former broadcast medical news producer who has been an editor and health communications specialist at CDC for 16 years. He has studied mathematics, economics, and business. He applied principles from those disciplines to building CDC's EPIC partnerships. These are a collection of relationships that CDC maintains with non-clinical organizations to help share potentially life-saving information during public health emergencies. Although Jonathan usually handles the Q&A session of these EPIC webinars, today he will be our presenter. Jonathan, please begin.
Thank you. Just 1 second, Azam, the slides. There we go. So next slide, please. So first, we're aware that some people may be connecting because they want to know more about the novel coronavirus outbreak. This webinar is not focused on that topic, although the suggestions from this presentation apply to many different types of public health concerns, including infectious disease outbreaks. If you want to know more about the outbreak, please go to cdc.gov/coronavirus/2019-NCOV. Thank you. Awesome. Next slide, please. So I'm a math nerd, and so I apologize for this, but they're letting me get away with this little bit of indulgence here. And this is going to explain why it's so hard to predict how you can communicate through a complex social network. I have cards. Now, I've shuffled them. And what you may not know is that this deck of cards in this order, more than likely, this is the first time in the entire history of the world that a deck of cards has been in this order. And more than likely the last time that will ever happen. It seems impossible on the surface. But if you look at the math on this, first card has 1 out of 52 possibilities. The next one, 1 out of 51. That's a number called 52 factorial. If you're watching the screen, you can see it's an incredibly large number, and it's vastly more than the number of atoms on Earth. So the reason this is relevant to partnership communication is because when you are communicating with partners, and from there to other partners, and from there perhaps to constituents, you have a complex pathway that your message flows through. You can't predict how it's going to go. It's just such a complicated system that instead of trying to be precise about it, you have to work with general principles. And sometimes, and I'll show you in a minute, sometimes you'll get a great result and sometimes you'll get a less than ideal result. Awesome, next slide, please. Okay, so here's why we need communication partnerships. The channels we work with for communicating, such as news media, social media, various clinical channels, reach specific audiences. They can be very effective, but they might not reach everyone. Communication partnerships help us reach those hard to reach people who may be the ones we most want to communicate with and may be most at risk. A few examples are isolated people in a hurricane, older adults during a bad influenza season, migrant farm workers during a mosquito-borne disease outbreak, and these are all things EPIC has had to work on for communication activities. Azam, next slide, please. Here are a few examples of the partners that we use to accomplish this. Pardon me, screen moment here. Okay, we have 60 communication partners. A few examples, we have some faith-based partners, we have some governmental partners, we have some partners who work in the emergency response community, some who have an international presence, but also a presence in the US, some that work at a very local level. And Azam, next slide, please. These partners were selected for their ability to help us reach people. So I'm gonna do a quick demonstration, and I am going to present my screen here. I'll just take a second. Share. Okay. So I'm going to demonstrate why we need to not only work with partners, but why it's so important to maximize the methods we use to work with partners to have successful communication. So this is an application I designed that demonstrates how viral messaging works and why it's inconsistent, even with the exact same parameters. So here, each column represents kind of a different layer of communication through the network, and each dot represents an organization. The odds of a partner for this simulation passing your message on are 50%, and the number of messages they pass it on to is set to 2. So I run the simulation. It only reaches 1 person. I run it again. This time I get 2 organizations. But you can see with the exact same parameters, just a few tweaks can make a difference between reaching a few or having, as we see here, fairly extensive market penetration with the message. So it's important to understand those techniques that increase the probability of retransmission and hopefully the number of organizations your partners pass your message on to. Azam, can we go back to the slides now? So here's how these principles apply. In that simulation, each node is a communication partner. Each line is a moment of message transmission. The probability of a message being transmitted can be low, and this happens if maybe a partner organization is not motivated, they don't know you very well, they don't trust you very well, they may be very busy, they may have staffing problems, they may be sick. So that can happen. The more nodes it takes to get from where you're starting to the people you want to reach, the harder it is to be successful, because there's a possibility of the message being interrupted each time. Okay. So what that means is flat networks are better. That is, if you're starting from where you are and reaching several different organizations, and they may only go 2 or 3 levels down before they reach the target population, that is a lot higher probability of success than if you're just communicating with 1 or 2 and expecting them to do all the work for you. We find that direct outreach improves retransmission. So when we're trying to pass on what is potentially a life-saving message, we share that information with a partner and we call them up and we say, hey, we're sharing this information. Can you please share this? And getting that sort of that personal interaction and that confirmation, oh yeah, this matters to us too, we'll pass it on. That seems to make a huge difference for us. Finally, messages can be corrupted. If you are, for instance, sharing information with the media, and rather than taking what you produce, they're interpreting it and then sharing that interpretation with their audience, that message may be altered. They may not focus on the things you want them to focus on. So if you have an electronic message and people are just passing it straight from your organization to the end user, it gets mostly uncorrupted by the time it reaches them. And that can help a lot with accurate information sharing. Azam, next slide, please. So I divided this up into steps. Step 1 is segmenting the audience. Any of you who've taken a marketing class will recognize this as the first step. There are certain questions you can ask yourself to segment the audiences you want to reach. One of these questions is, which groups will not likely be reached through mainstream media? If you're relying on media or other very reliable networks, and that covers all your needs, that's fine. But if you think about groups like those with limited English proficiency, people who have sensory barriers, so maybe difficulty with hearing or vision, people who might be isolated or that might come from a subculture that is sort of socially partially disconnected from the mainstream culture, that all those things may be a concern, and so you may need to find organizations that serve those groups. You also have to ask who will need specific information that they would be unlikely to receive from mainstream media. So you might be sharing messages with regular media outlets, but certain specific pieces of information might be something they might not be as interested in passing on. So specific messages for pregnant women, for older adults, for people who are experiencing power outages for multiple reasons. Those messages you may need to work with communication partners. And so you find those partners that can help deliver those specific messages to high-risk groups. And then finally, which groups may not, I have a visibility problem here. Which groups may be disconnected from your organization, even if they are otherwise connected to sort of a larger social network. So it may be that your natural communication recipients are sort of different from the groups, from like some particular group you want to reach. So you might need to find a specialty organization just to reach that group because they're just not naturally connected to your organization. Okay, awesome, next slide. Okay, so here's some examples of audience segmentation from the EPIC team. For reaching primarily Spanish-speaking populations, we have more than one for a lot of these examples, but one example is we have a partnership with the Hispanic Federation. One example for subcultures, we made a partnership with the Center for Haitian Studies, an excellent organization that operates in Southern Florida, that helped us communicate about Zika to pregnant women, to pregnant Haitian women during the outbreak. We have a couple of migrant farm worker organizations that we're connected to as well. For cultural isolation, people experiencing homelessness can be very isolated, not always actually, because sometimes they may have a degree of electronic connectedness through libraries, but they can be socially isolated. So we have two different organizations that focus on homelessness that we've partnered with, and we've also partnered with the Public Library Association, who serves a large homeless population, and they've been very helpful with helping share information. And then another example is for persons experiencing hearing loss is the Hearing Loss Association of America. They have actually been an excellent partner of ours for multiple reasons. Azam, next slide, please. Okay. Step 2, identify partners who can help with communication activities. So it's not enough that the partners serve an audience you need to reach. You need to make sure they have the ability to share information. So seek out partners who can provide information to you to redistribute to others in your network. That can be a very useful tool, and EPIC has certainly done that. Seek out partners who can help disseminate information to target audiences. So that means they have a constituency you might want to reach. They have a mechanism to reach that constituency, and they have sufficient staff size and engagement and personal interest to help accomplish this. And then finally, partners who can offer insight on communication needs. In the previous slide, I had mentioned the Hearing Loss Association of America. They had a profound effect on the EPIC team because they influenced us to start providing live closed captioning on our webinars. And they were absolutely right about that. So it's nice to get not just somebody who can help you distribute messages, but who can contribute to your messaging activities and help inform you on how to do it better. Okay, Azam, next slide. So, of course, we can think about sectors in many different ways. We focus on public sector, nonprofit sector, and private sector. Awesome, next slide. In the public sector, when you're seeking out partners, is typically we break it down to federal, state, and local levels. Example of federal partners are like CDC, FEMA, and SAMHSA. Federal partners can be very large, lots of people, and of course, no organization has perfect inside the organization communication. And so that means if you want a specific federal partner for a specific activity, seek out the teams, the functions, the groups that work on that activity and partner with them directly. That just seems to be more effective than trying to work from the top down in federal government. At the state level, of course, for those of us working in public health, state health departments are excellent partners on many levels, and they often provide several different teams that one can work with. But also consider working with state-run assistance programs, simply because they might serve populations that you have a high interest in reaching with communication activities. They might have a very ready mechanism to share those messages. At the local level, of course, again, health departments, but also schools. We have a phrase, teach the student, teach the parents. That is a very useful technique. If you can share information with schools, especially high school students, you can share some fairly detailed information. It's a great way to get that information to the entire family. So just something to bear in mind. Azam, next slide. For the nonprofit sector, which we have many nonprofit partners, consider emergency response organizations. Of course, a lot of people that attend our webinars are coming from emergency response organizations, but consider partnering with them, even if you're going to work on more than just like disasters like hurricanes or floods or something like that, because they have a lot of resources and a lot of motivated volunteers. Of course, National VOAD is an excellent organization, but if you look at the state and local level, there are also several VOADs, that's voluntary organizations active in disaster, and they can be a great resource to partner with. Faith-based organizations can often reach specific populations, which is helpful. They're often very highly motivated, and they have established a lot of trust with the people they serve. So that's a great way to, again, get a motivated partner who's likely to pass on your message. And then community-based organizations also might serve a specific subculture, and they might have sort of several excellent ways to share information with that group as well. Okay, awesome, next slide. The private sector. I've heard multiple times people say that they're a little bit hesitant to partner with the private sector because they're worried about the inappropriateness of partnering with a government organization and the private sector. But when you're talking about emergency response, we're talking about saving lives, and that's what comes first. So when we're talking about communication partnerships, it's worth doing, and we just work through all the other potential difficulties. You can seek out specific companies if they serve populations you want to reach. Trade organizations. So we are partners with a couple of pharmacy trade organizations and a couple other organizations as well that serve kind of the larger business community. Of course, clinical partners, which I'll mention on the next slide. And the reason they matter so much is that, especially during a natural disaster, during several different types of emergencies, they can be a first point of contact. So building supply stores, pharmacies, grocery stores, gas stations, these can be the first place that people go. That's why they're useful to partner with. Okay, awesome, next slide. So clinical partners is a special topic, and CDC has its own team devoted to establishing clinical partnerships for emergency communications. Public health emergencies can present unique challenges, and providing the right information for clinicians can save lives. It can save lives because it can both influence what the clinicians do, and clinicians can influence the actions their patients take. Developing and maintaining strong partnerships with clinical organizations is critical for successful notification, um, for sharing, for training, and that's because clinical partner organizations serve more. They might have thousands, some even hundreds of thousands of clinicians that they serve, and more than just physicians. So when you share information with the right clinical organizations, you have an excellent ability to reach a large number of people. And that's why we have our own separate team for this. Awesome, next slide. Step 3, make connections before an emergency. Of course, sometimes you have to have what we call a just-in-time partnership, but if you can, build your trust, build your relationship ahead of time. That means making initial contact, having a discussion to reach an understanding of how each organization operates, of how you benefit each other, and what your mutual expectations are. We typically do not seek out formal agreements because they become more difficult than they're worth, but for many people, it may be helpful sometimes to have a memorandum of understanding. Awesome, next slide. Step 4, maintaining connections. This actually occupies a large portion of my work. It's not enough just to establish that connection. You have to make sure that you keep it going. That means updating and confirming contact information because sometimes your point of contact has moved on. You might have to reestablish, essentially rebuild the partnership from scratch. That means reaching out to them and having conversations. We like to feature our partners in our newsletters. It's a great way to show what excellent partners we have, and it's a great way to maintain that relationship. And then just in general, mutually participating in activities can also help maintain that connection. Awesome, next slide. Okay. And then finally, step 5, where all of your work has paid off, working together during emergencies. The first thing I would say about this is listen to their needs. It is, if you are sharing information to try to help people, you want that information to be as focused as possible on the needs of the people you're trying to help. Organizations that represent those people can tell you exactly what you need to send, what you need to share to have maximum impact. So listen to their needs, obtain information from appropriate partners and other sources. So CDC is often the primary generator of information and of information products, but not always. And others doing this kind of work may not be the primary generators, but you can, if you've established a relationship with CDC Epic especially, or maybe with FEMA or HHS, I mean, there's a lot of sources, then you know ahead of time where to get your information. So you can quickly go, get that information, then share it with your partner organizations who will then share it through their channels. Awesome, next slide. So to make this work, you need to have effective messages. Just a few simple tips for how to create an effective message right to your audience. We talked about partners telling you what their constituents need. That means you create customized documents that serve those constituencies and that are written with the appropriate language and the appropriate cultural references to have maximum impact. Your initial content during an emergency should be short, should be relevant, should give positive action steps, and you might need to repeat the message. A lot of this comes from CIRC, Crisis and Emergency Risk Communication, which is CDC does a lot of communication about that topic, and I would suggest looking to CDC CIRC and studying CIRC to become to learn more about creating effective messages. Awesome, next slide, please. So here are some examples of successful EPIC partnership activities. In 2017, the National Community Pharmacists Association, an excellent partner and an excellent organization, shared information on pharmacies that were open shortly after Hurricane Harvey. So this was critical information because some people needed medications, didn't have access to them, they didn't know where to go. So we took that information, that list, we shared it with all of the EPIC partners and with some other groups locally so that they could share that information with people in the affected area so that people could access their medications. Another example, CDC shared Haitian Creole documents with the Center for Haitian Studies during the Zika outbreak. This organization actually provides some clinical care for Haitians in Florida, and so it was just a great opportunity to have documents printed in the appropriate language that they could directly share with pregnant Haitian women to help them prevent getting Zika. And then I'm especially proud of this. A year ago, Peter Gudaitis from the National Disaster Interface Network presented an epic webinar about the ways that congregations can contribute to emergency responses. Please check out that webinar if you ever get a chance. It was excellent quality, and that's an example of a shared activity that helps build a strong connection, and we continue to have a strong connection with INDEN. Awesome, next slide. So, another example, we have created just-in-time partnerships with organizations that serve the Congolese diaspora. We reached out to them. We kind of established these relationships. We happen to have a staff member from Democratic Republic of the Congo who is able to help with this. And we've shared information with the diaspora and with diaspora leaders so that they can share that information amongst the diaspora, and some of whom will also share that information with friends and family back in DRC. Awesome, next slide. Okay, and here's a picture from working with communication partners in Puerto Rico, where we were handing out a variety of information and supplies to help with the Zika outbreak, actually. Awesome, next slide. Okay, and then here are some lessons we've learned from these interactions, from working with our partners. Respect the partner's mission. It is a two-way street. We're trying to accomplish something. They have their own mission. It's not simply about how they can help us. It's about how we can help each other. If you go into it with that mindset, it'll affect all of your interactions. It'll create a much more positive, trusting relationship, which will mean the communication partnership works during an emergency. Making regular contact, assisting them with their information needs, because you may have specific types of information they can use, using their expertise. So just as CDC would have expertise in, say, infectious diseases, for example, if we work with organizations that represent people experiencing homelessness, they can provide us with knowledge that we can use. And for organizations having an opportunity to use their expertise professionally, especially on a large scale, actually helps build and maintain their high reputations. So it's beneficial on both sides to use your partner's expertise. And then this all kind of can be summed up as understanding the entire value of exchange. This is a concept in business where it's not simply an exchange of one thing for another. You're providing a lot. You know, our partners might provide expertise, communication channels, a type of validation or vouching for the partners they work with, and we might provide critical information, for example, and access to CDC experts. Understanding the full exchange that goes on there really helps perceive the value of the partners that you seek out and that you can work with. Okay, awesome, next slide. So there are some sticking points, and these are things to just bear in mind. A lot of organizations have controversies, so you have to do some background research. Just be careful. You don't want to get mired down in something that might cause reputational harm to your organization. Looking out for political sensitivities or a strong political bias. We're a public health organization. We work with organizations, with partners that in some way contribute to the public health. So for us, this has not been a major issue, but again, just something to consider. You want to make sure that you have the resources to be a good partner and to make sure they have the resources to be a good partner. Otherwise, it winds up just being kind of a waste of everyone's time. It is worth considering whether there is any intense distrust from a particular constituency. That doesn't mean you wouldn't communicate with them, but it might mean that you need to go to extra links to establish a trusted relationship to be able to successfully communicate with them. Language barriers, of course, are a huge concern. And then it can be difficult to measure success. Like I mentioned, sending a message through a network, which might go through dozens of nodes, hypothetically, before reaching somebody, you really don't know. You don't have any means of seeing if it's working. You can kind of generally see if your total communication efforts are having some effect. There are a variety of methods to do that, and that's a topic we might explore in the future for a presentation. But it can be difficult to precisely measure the success of any given activity. Okay, Alvin, next slide. A few skills. I am a student of conflict resolution methodology, and I recommend that for absolutely everyone. Cultural competence, and please be sure to check out, if you go to the CDC EPIC website, you can see that we actually had a webinar on cultural competence, but we also have a website that provides some information on how to learn and acquire cultural competence, because of course that's just a critical part of working with partners from different cultures and communicating across those cultural boundaries. And then of course, languages as needed for reaching your constituency. Azim, next slide. Okay, and here are a few partnership resources that can be useful. Here's one for reaching at-risk populations in an emergency. Another one that describes principles of community engagement. And then of course the CERC chapter on community engagement. And then I just generally recommend studying the CERC manual if you have time. Yeah, awesome, next slide. And that's it, we can start taking questions.
Thank you, Jonathan. And we will now transition to our Q&A session. Lisa, can you read the first question?
Absolutely, Jonathan. Our first question comes from Mitchell Collier, who asks, do you have any thoughts about making sure that about partners do not feel that they're being used in a one-way relationship?
Absolutely. The most important thing is when you are taking action to serve their needs, follow through. That's the most important point in all of this. I mean, when our partners reach to us for information or for help in something they're working on, we don't always succeed, but we always respond, we always try, we always make sure they know that we're not using them, that we see this as a two-way thing. Also, if you promote what your partner does, it makes you look good because it shows that you have a mindset of wanting to create a culture of cooperation that makes you look good to your constituents, and it certainly builds a good rapport with your partners. Lisa, next question.
Thank you very much. An anonymous attendee asks, could you please explain again what is a flat network?
Well, I can. Okay, I hope you can see my hands here. You start from one point and you go to your next node in your communication network, and you go down one more level and then down one more level. If you go 50 levels through that means the message starts from you and goes through 50 different organizations before it reaches your target audience. That's likely to fail. That's likely the message may get corrupted, the message may not get passed on. There are too many opportunities for failure. If, on the other hand, you have 50 different partners that you're working with, and it just goes from you to all 50 of them, and then from them to maybe one more layer down to the constituencies, then you're not going through as many layers of communication, which is more work because you have to reach more partners at the outset of the network, but it's a much higher probability of success. And if you want to get deeper into the math nerdiness of it, please just email epic@cdc.gov. I'm happy to follow up on that.
Thank you. Our next question comes from Mary Kate. Could you talk a bit about how you engage partners during routine times?
We can. So we actually have taken a lot of time to figure out how we're going to go about doing this. We don't just want to call people up and say, oh, hey, how's it going? Glad to see you guys are doing well. We want to have meaningful interactions. During for us, what we call a non-activation period, or a like a pre-emergency period, we engage in a lot of preparedness work. And so we engage our partners in that same preparedness work. By doing that, we're constantly engaged with them. We're helping them stay at the level they need for when an emergency happens. And then, of course, that means we have that trust already built up. So I would say during non-activation, work on preparedness work, find reasons to work with your partners on that kind of preparedness, as well as engage in a lot of sort of shared communication activities.
Thank you very much. Our next question is, can you clarify the role of CDC versus state or local partners in health communication during national emergencies, particularly as it relates to harder to reach groups, to make sure they don't fall through the cracks?
You know, there's a phrase, all disasters are local. So it is not a question of whether or not CDC or a state or a local group is trying to reach these hard to reach populations. We're all trying to reach them. From CDC's perspective, we have direct connections to a lot of state health departments, to a lot of local health departments. So we will share information they can share through their channels. But if we have direct channels, if, for example, I can share information with Salvation Army, who can maybe share that information directly with someone who's just experienced a flood, and thus they're electronically disconnected, or they might have something printable that they can share, for example. If we have that direct ability, we'll go ahead and use it, because it is a situation where the communication to save lives is what's most important. So it's not a question of either or, we're working all channels at once.
Excellent, thank you. And as I offer the next question, I'll let you know that because it pertains greatly to my work as well, I'm happy to chime in. But Marisol asks, I know it's hard as a government agency to gain the trust of undocumented residents. What techniques do you recommend for reaching them and communicating with them?
I am going to defer to Lisa on this. I'm going to make one quick comment, which is that sometimes people see government as a monolithic entity. But in fact, of course, it's several different organizations under one umbrella. It may be possible to build some trust for one part of government, even if people have perhaps an intense distrust for government as a whole. And then I'm going to defer to Lisa.
Well, thank you very much, Jonathan and Marisol, and to all listening. I want to affirm what Jonathan said, mention that on EPIC, we work as a team to get information to our partners. We have a wide variety of partners, but what we have heard time and again, it's that trust building relationship, those people who are actually active in the communities, who are the trusted messengers. They're going to be the ones who are able to connect with community members, including undocumented residents, to get those messages out. And so our role is to connect to the people who connect to the communities. And while as a large government agency, we do not have the ability to connect well with every community across the nation, we do work closely with our partners, especially to find out whether there are communities that are not being reached, whether there are questions that are not being answered, and we do our best to be responsive to those.
It helps too that if we create a message in a document and we pass that on to a partner organization, and then they take that message and they pass it on to their constituents, it's communication coming from an organization that the target audience already trusts. That helps a lot. I mean, because they can believe a message even if they don't trust the government as a whole.
And I'll add to that too, the value of consistent communication. Again, that's a concept that you will find reiterated in CIRC, Crisis and Emergency Risk Communication, and we will share the link at the end of the webinar. But you'll find that if we share a message with our partners and that message is consistent with other partners, that the people in the community are going to get that same accurate meaningful response from multiple places, and they're going to find that they're able to trust that message better.
Excellent. Next question.
Okay. We have someone, Frank, who says that he's active in this community in New York, but often feels that there's not enough, and Frank, forgive my paraphrasing, but there's not enough follow-up, and he's looking for tips for more active engagement with partners.
It's not something you do by happenstance. It's something you plan out. That's the number one thing. You don't sit there and say to yourself, well, today let's try this or let's try that. It's something you actually have to make a plan for and execute. One of the things we did with our partners was like a plan to reach out to them and ask them a preset set of questions to verify that they're still connected and see if we're serving them in the ways they need. And we actually had to go to a lot of trouble. Federal government, there's something called the Paperwork Reduction Act. So you can't just poll people, you have to get permission to do that. And we went to the trouble to do that because it's worth taking the time to do that. So what I would say is make a plan. In that plan, incorporate shared activities, things you can do together. Incorporate a lot of preparedness activities if you can, because that helps build that trust before the emergency comes. And finally, if you have a communication channel, talk about your partners on your communication channel. That makes you look good, it makes them look good, it's just beneficial across the board. Okay.
Thank you. Our next question is, can you provide more information on what a just-in-time partnership is and how you incorporate them into your planning and preparedness efforts?
You can't anticipate everything. You can't anticipate, and you wouldn't have the time to form, 2,000, 3,000 partnerships. So when something unexpected comes, such as having to work on an Ebola outbreak in Democratic Republic of the Congo, then you're going to need to find partners that serve the target population that you've never connected with before. The most important factor, because you have to do this quickly, and you don't know if they trust you or not, the most important factor there is for your organization to have a great reputation. If you have a great reputation, then when you come in and you talk to them, you're less likely to meet resistance. If possible, it also helps one of these just-in-time partnerships to form a connection with, like I say, a single member or a few members in the range of organizations that you want to serve, and then that person can help promote your efforts. We were very fortunate in the case of DRC to have a staff member from DRC who had connections in the diaspora already. That was just a blessing. So that kind of luck won't always happen, but you can form those kinds of intermediate relationships to help quickly establish trust in a larger set of partnerships.
Okay, our next question. What modalities are most effective in communicating with partners? Do you use driving them towards websites?
Well, I personally, speaking for myself, I prefer to share an email rather than drive them to the website. Because if they have an email, it's just one click away to take that email and pass it on to somebody else. So if I have the information already there, it's easy to pass on. People may or may not click a link to go to your website. It's great having a website because you can measure how much people check out what you have. But I personally prefer to have the information right in front of somebody's face. So that means you send it by email, they get it, and they can readily pass it on. That's the great thing about social media too, is that if you're connected on social media on like Twitter or Facebook or LinkedIn, and you post something, they can immediately repeat your posting on their channels. Okay.
Thank you. And I will add to that, that's one of the places where the cultural considerations come into play. You need to consider not only how would your partners like to receive information, but how would the people that they serve like to receive information, and make it as shareable as possible to the extent that you're able.
And I talk about how email is very convenient, but you have to look at the practicalities of the situation. I mean, sometimes you may have to print documents out and hand them out at a grocery store. We've had to do that multiple times. Sometimes you might have to rely on a type of word of mouth. If you're working with an organization that serves people in assistance homes, then they may be serving a population that may be experiencing some cognitive decline or other disabilities. And so the method of communication may be you share a document with them and then they interpret and read that document, even simplify and just explain to their target population. So selecting the modality depends on a whole lot of factors. But the one that I find seems to maximize passing on while reducing corruption would be email. That's just my personal preference. Okay.
Okay, our next question. I know that it's difficult to measure success, but what metrics have you tried to gather to demonstrate that your partnerships are having an impact?
Two main things. One, they let us know. They reach back and they let us know. I would caution against relying purely on numbers because it may be hard to get an exact precise number, but it is still meaningful to have a partner write back to you and say, hey, I shared this through our network. We heard back. A lot of people really appreciate this. Secondly, there is a whole science around monitoring media, social media, even monitoring discussion groups on forums. So if you have some electronic means by which your target population communicates with themselves, you can monitor that and you can actually get some somewhat meaningful numbers from doing that. It also helps if you have someone who's embedded, who can get a general sense of how your information has been received. So we have a whole research team that tries to provide this type of information. The point that makes it difficult is, was it your partnership communication that was successful, or was it your communication through mainstream media that was successful? This is a difficulty in all marketing efforts, which is that you use multiple points to reach people, to persuade them to do something, and then you don't know which of those points is what actually influenced the outcome. But you can observe to see if you did influence the outcome.
Thank you. Our next question is, what is an expected turnaround time in providing information to partners? Is there a best practice or does it completely depend on the case? Do you commit to providing updates on a schedule whether or not there is new information?
Certainly it does depend. But as far as the schedule goes, if you have an event that is changing on a regular basis, if nothing else, you can provide updates on like case counts, things like that. It would be somewhat questionable to provide an update which simply says nothing's happening. But I'm trying to think how to word this. We want to keep our partners as informed as we can. And so we will make regular contact. Try not to go more than a few weeks to make sure that we're sharing something. Through communicating with the EPIC partners, we do that. So even if it's not on a prescribed schedule, we do try to make sure that we're keeping them well informed because they expect that from us. And if it's kind of almost like breaking trust if we don't provide something on at least a semi-regular basis. Lisa, what are your thoughts on this?
I'd like to add to that, one of the more basic ideas of CIRC is that we say that when you're lacking information, you still want to update people with the information you do have. And so you can take the opportunity to tell people what you do know, tell them what you don't know, and tell them what you're doing to find out. So to answer the part of the question about updating on a schedule, that's certainly on a case-by-case basis, but as promptly as you're able to and as proactively as you're able to, even if the information you're providing is, here's what we're doing to find out.
And that's one phenomenon that we discuss in CIRC is that people tend to believe the first source of information. So even if you only have a little bit to share it right away so you become established as the information provider. People then tend to trust you. Okay, next question.
All right, looks like we have time for a few more. Our next question is, do you have any tips on how to figure out all the different groups, organizations that you should be reaching out to. For instance, trying to reach agencies that serve vulnerable populations. How do you build that contact list?
Well, first you need, follow the 5 steps I described here. First, you do need to segment your audience, because when you say, for example, reaching vulnerable populations, that means a lot of things. So you need to define what that actually means. Are older adults a vulnerable population? Are older adults in nursing homes or assistance homes a vulnerable population? If so, maybe you want to get online and find an organization that sort of serves that industry. Epic does have such a partner. So it's a question of figuring out who you need to reach, then figuring out which organizations can help you reach those groups, then doing the work to establish that connection.
And I'll add to that as part of your all hazards planning, you'll take into consideration what sorts of risks is my community likely to face. And from there, that might inform your decisions about which groups might be at greater risk, and therefore finding organizations that serve those groups.
And don't put it off, do it now.
And then as far as the question about how to build that contact list, sometimes web search is the best way. Sometimes connecting through other partners is a good way to do it, whether that's internal or external partners within your own organization that might have those connections, or people in your community that are outside of your organization that might also be able to help you find the right connections.
I mean, the great thing about a web search is that if an organization has enough resources to be a helpful partner, they probably have a website presence. And then, of course, partners or people you work with can just tell you, oh, hey, go check this out. And you can go look online and you can learn about them before you reach out to them. Because we have been in a situation where we're considering forming a partnership. We have a meeting and then we're like, well, I'm not sure this is a good match for both of us. But that can be a little bit awkward. So doing your research ahead of time online it's a good idea.
Okay. Excellent, thank you. And then could you please expound upon nurturing relationships and tips to improve that process?
So when we talk about nurturing relationships, there's building the relationship and then there's repairing any damage that may have been done. In terms of building the relationship, it is about establishing regular, meaningful activities. It helps to be just a personable person when you do that. In terms of repairing damage to a relationship, I cannot emphasize enough the methodologies in conflict resolution can have incredible results. I can't go into the details, but I have used those methodologies to prevent some what would be otherwise a failed situation. And it can really make a difference. I personally, if you want good street level conflict resolution, there's a book called Getting to Yes by Fisher and Ury. Getting to Yes is fantastic, and it's kind of the basics, but it's what folks in our kind of situation would be most likely to use. Okay. Any other questions?
Yes. How would you manage lone rogue people who are disseminating incomplete or incorrect information?
I would not want to work with them. My goodness. So is it that they are sharing their own information that conflicts with your organization? Because if that is the case, I would say just discontinue that partnership entirely. That's not hard to do. You can just explain to them, hey, it sounds like we're coming at this from different angles and it is a concern for us, and so we're going to need to discontinue this communication partnership. It could be the case that they may be a great communication partner, but they have some other aspect of what they're doing that creates a difficulty for you. And in that situation, you have to weigh out the political concerns, the reputation concerns versus the public health concerns. And that especially can be prominent if you're dealing with a faith organization whose faith may be in conflict with your organization's own standards. And what I will say is that it's been our experience that people are much more concerned about saving lives and much less concerned about your own reputation. Okay.
And I believe that may be all the time that we have for questions. If we did not get to your question, we apologize, but encourage you to send it to EPIC, that's EPIC, at cdc.gov. Thank you.
Thank you, everyone.
And thank you again from me and the entire team for joining us for today's webinar. If you do have additional questions, like Lisa said, please email them to epic@cdc.gov. And as a reminder, today's presentation has been recorded. Feel free to share it with anyone that wasn't able to attend. You can earn continuing education for your participation via the recording as well. Please follow the instructions found on emergency.cdc.gov/epic. The course access code is EPIC0129 with all letters capitalized. Thanks again, everyone. Goodbye.
Goodbye.